Hello, we're back, and we're going to be talking about Chapter 10, covering diseases of the eye. All of these codes begin with the letter H and run from H00 through H59. These include diseases of the eyelid, the lacrimal system, the occipital orbit, the conjunctiva, the sclera, the cornea, iris, ciliary body, choroid, retina, lens, and basically anything involving the eye. Also covers, of course, the optic nerve, ocular muscles, and any intraoperative or post-procedural complications of procedures done on the eye. There are a lot of instructional notes in this chapter, things that say use external cause code, and a series of excludes 2 conditions are also listed. There are different guidelines for assigning glaucoma codes. These are mentioned in your text and also mentioned in the code books. Please go to these particular chapters and you'll be able to see these guidelines in the very front. They're guidelines for bilateral glaucoma with the same type and stage, bilateral glaucoma with different types or stages, and how to code when the glaucoma in stages changes during the course of a hospital admission. This chapter covers not only post-procedural complications, but any infection, inflammation, lesions, deformities, anything involving anything that impacts vision. These diseases can be coded with infectious diseases and parasitic diseases and diseases from other chapters, such as diabetes, external causes for injuries, and others. It may be helpful to review figure 10.1 in your text to get a view of the anatomy of the eye. For diseases of the eyelid, lacrimal system, and orbit, these fall into a code range of H00 through H05. And basically, the lacrimal system is all those structures that produce tears and drain tears away from the eye. The orbits are basically those bony cavity where the eye sits in the skull. And these have associated muscles, nerves, blood vessels, and we can have all different types of diseases. You can see these terms here: hortolinium, blepharochalisis, and others, which are great terms to use for main terms. The conjunctiva is basically the mucous membrane lining on the inner surface of the eyelid. Sometimes this can be infected and we can have conjunctivitis, which can either be acute, chronic, or blepharoconjunctivitis. And the cause can either be bacterial or viral. There's a note under code subcategory H10.21 for acute chemical conjunctivitis that states that we code the chemical that caused the conjunctivitis first. These codes would fall from a code category series of T51 through T65. This could be an occupational injury. And again, the main important point here is to code the chemical that causes the conjunctivitis first. There are other disorders of the sclera, cornea, iris, and ciliary body, H15 through H22. And these are the keratoconjunctivitis, iridocolitis, keratitis, all these different types of things. These make also great main terms in the alphabetic index. Since we have 2 eyes, an important point that you would only get from the tabular is things are either right, left, bilateral, or unspecified. But you need to, with all of these conditions of the eye, make sure that you're picking up the laterality. Anything involving the lens is H25, H28. And when we think of disorders of the lens, normally we think of cataracts. Cataracts, again, have a left, right, bilateral, and unspecified. For an age-related cataract, sometimes referred to as senile cataract, we have the code category H25, right? And of course, we have other ones involving as well, the cortical cataract, subscapsular cataract, and so on. With all these, the main term would be cataract. Anytime we have a disorder of the lens, it's H25 through H28. And again, we can also have not just the age-related or senile cataracts, but the juvenile cataracts, which fall into code category H26. These could be congenital cataracts that are present at birth, but may not be identified until the child is older. We can also have lamellar, polar, total, or nuclear type. And these can be part of other congenital defects such as congenital rubella, Down syndrome, and others. And again, we have disorders of the choroid and retina, H33, H36. And when we think of retinal disorders, the one that comes to mind is the retinal detachment, which is H33. And this involves any separation of the inner layers of the retina from the rest of the retinal epithelium, which is attached to the choroid. The choroid's a vascular membrane, if you will, between the retina and the sclera. And many times we'll get a tear or break where the fluid from the vitreous cavity in the back will seep in between the retina and the retinal pigment epithelium. And the most common is the rhegmatogenous detachment of the retina, or the retinal detachment with a retinal break. With retinal detachments, we can also have a term that we see is the vitreous floaters, right? And it's a floating spot that sits in the patient's vision. And the patient describes cobwebs in their vision, right? So important to be clear on these terms and look for the main terms. I have for you. You may want to check out the article about ophthalmology main terms that's below this video lecture.